Hello everyone, my name is Vanessa Aguirre. I am a PNP student. Today I will be doing my topic on modernizing communication in the obstetric unit, a dedicated smartphone solution. First, we're going to be talking about what is the problem. So on this unit, nurses have to contact an operator before the physician. So you find a phone that's on the unit and you dial a certain code that the hospital uses and it connects you to an operator. The operator usually tells you you are second in queue, you are third in queue, you are first in queue, and based off of that number, that is when you get to speak to the physician. And that's when you tell the operator, I would like to speak to this physician, and they say, okay, let me get them on the line. This can often lead to delay of urgent communication, delays of critical laboratory values, and it can also create communication errors because there are multiple handoffs in between. The proposed solution is to get a dedicated unit smartphone to directly contact physicians for emergencies, updates, and orders. This will allow the nurses to use this rather than to have to go through the PBX operator. All physicians' numbers will be saved in this phone, so it's very quick to get a hold of them. Orders can be received on this phone, and all calls, text messages will be time-stamped, so you will never have to worry about when you sent that message or when you made the call. Mobile phones are becoming a lot more popular. All physicians tend to use them throughout the hospital just for everyday work, whether it's getting on the internet, whether it's looking up lab values and getting on the portal. So this just kind of goes hand in hand with what's becoming new. Now we will be talking about the evaluation of the technology. So our current problem is that nurses have to contact the hospital operator prior to reaching any obstetric provider, which can cause delay in care, delay in patient care, especially because if there is an emergency, you have to step out of the room and wait on that operator line. And then why is this a problem? Like I said, delays can postpone clinical decision making, especially during emergencies. Nurses are already experiencing an increased cognitive workload, so not only are you having to worry about what to do with your patient, but you're also having to have yourself on the phone and wait in a queue to get a hold of the physician. There's an increased risk of missed messages, misunderstandings, and communication failures. The current workflow, nurses must complete extra steps prior to receiving provider guidance. So that's also just repeating that it's delayed communication and delayed care. Interoperability. Currently, the communication process is not integrated into a streamlined clinical workflow, and we rely on the PBX operator. And when it comes to cognitive workload, nurses have to divide all their attention between patient care and operator wait times. This increases the risk for potential errors, potential misunderstanding, or potential medication misdosages. I wanted to give some specific examples, especially on the obstetric unit. So if you have recurrent fetal heart decelerations identified, you have to call the operator to get a hold of the physician. The operator queue delays that physician notification, and then in result, the bedside assessment is delayed. If there's a postpartum hemorrhage that's recognized, your operator pages the OB provider, but your interventions are delayed because you have no orders until you get a hold of that physician. Lastly, when a critical lab result is resulted, a lot of times laboratory comes and draws labs and you already have to wait for the result. But if it's a severe preeclampsia and the doctor's specifically wanting to look at those low platelets, if they are low, you have to call the operator, and if there's a high Q volume, it can delay that notification even further. Next, I want to talk about primary versus secondary data. So with primary, I would like the nurses to complete a communication log after every OB emergency over a 2-week period. This communication log will include what the emergency was, what time was it recognized, what time did we call the physician, what time did the physician get to the bedside, and what time did they respond. When you go to secondary, I want a review of all of the timestamps, PBX call records, and cell phone call logs over a 2-week period. This will include provider notification times, physician arrival times, emergency interventions that were given, and then I want to compare them to the PBX operator information and see if there's actually a correlation and if the delays in care are reduced. Some key findings that I found in the literature was that communication delays interrupt workload, direct communication improves efficiency, one dedicated communication pathway allows for decreased communication errors, and prompt response time reduces adverse effects for both maternal and neonatal factors. Now let's talk about my solution. So my proposed solution is a dedicated smartphone. This will have direct provider calling, secure message capability, bypass PBX operator, faster emergency communication, and improve workflow efficiency. So I want to give an example. If a patient is actively hemorrhaging and a nurse calls the provider directly through the smartphone and receives orders within seconds of the call, the patient can be given medication to help stop that bleeding. Rather than waiting in a PBX operator and being third in the queue where you have to wait longer and your patient's actively bleeding, you want orders right away. This dedicated smartphone will be used solely to contact physicians, and it goes directly to their phone, and you do not have to worry about waiting in any queue. Literature support. I've read through multiple articles, and the things that I found that were most common were that mobile devices are becoming increasingly more popular in healthcare and in general just being used by healthcare providers a lot more than they used to be. A way to address disjointed communication and information access is to integrate digital technologies into care. And lastly, use of a smartphone in some units on a hospital were found to minimize physician-nurse communication wait times. Now I would like to give some examples for workflow changes in nursing, physician, and organizational categories. So for nursing, your time spent waiting on operators. That's the biggest thing, the biggest problem on this unit right now when it comes to communication with the physicians. So transitioning to the cell phone will be so much easier to just directly call them. When it comes to physicians, they have a delayed receipt of urgent messages. With the cell phone, you'll have prompt responses from your physicians. And lastly, organizational. There are potential increase in near misses currently with the PBX operator, but with the cell phone, hopefully it will help reduce these adverse events from delayed response time. Evaluation and outcomes. So I want to talk about some measurable outcomes. I have 3 of them listed here. So 90% of staff will achieve competency with the smartphone through training completion by 4 weeks. Secondly, PBX operator calls will be reduced by 75% within the first 3 months of initiation. And lastly, within 12 months, communication-related adverse effects will be reduced by 25%. And to evaluate these, I want to use the call logs to identify how many calls are made off of the cell phone, staff surveys to ensure support is given and received, quality improvement data, and then incident reports for any adverse events. Moving forward, we are going to talk about stakeholders. So in this project, the stakeholders include nurses, physicians, IT, hospital leadership, and patients and families. SDLC method. So in this method, there is planning, analysis, design, implementation, testing, and post-implementation. For the planning, you want to identify the communication delays and formulate a solution. Analysis, you want to assess their workflow needs. You want to design, so I selected the smartphone platform. You want to implement pilot on the OB unit. You'll activate a smartphone on a weekday when IT's present, when leadership's present, so that everybody feels supported throughout this change. All staffing will be allowed to use phone for trial call with OB on call, and the phone will be used for any emergencies that occurred that day. For testing, you want to evaluate usability and get feedback from staff after the shift. And then your post-implementation is your continuous quality improvement. You want to continuously make sure everything's working good. You want to make sure that you're getting your staff feedback and make sure that they feel supported and that they feel like this is a positive change for the unit. Barriers. There's always barriers to any project implementation, but for this project specifically, there could be some staff resistance. So I want to ensure that we offer multiple education sessions, that everybody feels safe, supported throughout this transition. Secondly, cost. So I want to get pre-approval from leadership. Training needs. You want to offer multiple education sessions with hands-on options. Everybody always feels better when they're able to do it with their hands and get a feel for it before having to do it on a day for work. And then lastly, technology adoption. I want to pilot the implementation, but I want to ensure that it's a day that IT is available. Next, we're going to be talking about ethical, cultural, and organizational concerns. So first, you have HIPAA and ethical concerns. So secure communication must be maintained, patient confidentiality must be maintained, and role accountability. For data privacy and security, the first 3 letters of the first and last name of the patient can be used for direct messaging. You should not be using full names or room numbers. There'll be a 5-digit password to unlock the phone, and the phone will be located at the charge nurse desk at all times. For organizational readiness, you want to make sure you have leadership support, staff engagement, training resources, and a positive safety culture. For cultural organizational influences, you want to make sure staff is willing to embrace change. Policies must support secure and standard communication, and leadership commitment also helps bring a lot of positivity towards the project and implementation. Lewin's change theory. You unfreeze, you change, and you freeze. So in the unfreeze category, you're going to present your problem, explain the patient risk, engage nurses and providers early on, address concerns, and get feedback from staff. Then you're going to make your change. You're going to introduce the smartphone, provide training, pilot technology, and offer IT support. And then you're going to refreeze when all of that is done, and you're going to incorporate the smartphone into standard workflow, update policies to reflect the change. You're going to monitor communication outcomes, reinforce success through feedback and education. Lastly, for conclusion, I want to kind of sum up everything that we talked about. So communication through the PBX operators is the problem. It delays patient safety. Our current workflow creates barriers for staff and patient safety. A dedicated smartphone is the solution and can be used to improve communication. Provider response improves with direct calling from staff and reduces delay in patient care. Improved maternal and neonatal outcomes can be improved with proposed technology. Included are my references for this project. I appreciate you listening to it, and I hope that you found it informative. Thank you very much.